Hello, and welcome to my channel, the 5-Minute Child Neurology Consult. My name is Dr. Pawan Kashyape, and I am a UK-trained consultant child neurologist with more than 15 years' experience in the field, currently living and working in the UAE. I frequently get asked questions by patients, families, and colleagues on day-to-day or common neurological problems or issues in their children at home or in the community. Googling these topics frequently gets overwhelming due to the sheer information overload, not to mention a lot of misinformation which can get practically dangerous. This often leads me to giving a quick 5-minute consultation on the phone on how to deal with these common neurological conditions at home and when to seek medical advice. Considering this, I thought, why not start a channel so that I can give this information to a wide range of audience across the world. And hence, with that in mind, I have started this channel, which is called the 5-Minute Child Neurology Consult, in which the intention is to address common facts and myths about different child neurological conditions in the community. Please be aware, this is not intended to be a medical advice or treatment-related advice, and appropriate medical consultation is warranted from your doctor when in doubt. So today we will talk about headaches in children. First, let us talk about the 5 facts regarding childhood headache. Number 1, headaches affect up to 10% of normal school-going children and adolescents, and thus they are very common. However, they can be sometimes quite disabling, leading to loss of school days and productivity in some cases. Number 2, migraine and tension headaches are the commonest types of headaches affecting children. They are also called primary headaches as they do not have any specific underlying cause, and if you do scans, for example, for these patients, they are invariably normal, as well as other tests come back as normal. However, migraines and tension headaches can cause a significant deal of disability in the patients. Number 3, let's talk about migraine headaches. So these are headaches that cause severe throbbing pain, usually on one side of the head. However, in younger kids, the whole head hurts, and these headaches are frequently accompanied by nausea and vomiting and a dislike for sounds and light. Children may also experience tummy pain during these headaches. Number 4, tension type headaches are dull, aching type headaches as opposed to migraine, and these usually affect older kids like adolescents and usually occur at the end of a busy or stressful day, and they tend to cause a pressing sensation on the head. Number 5, one of the common questions that I get asked is, do the headaches mean something serious underlying, like a brain tumor? But let me assure you that serious conditions like brain tumors are a very rare cause of headaches in children, and they also have other clinical signs like loss of balance while walking, double vision, and a loss of weight. So if your child is otherwise healthy, there is extremely less chance that they have an underlying brain tumor as the cause of the headaches. Okay, now let's talk about what to do when your child complains of a headache. Number 1, ask them to wind down and stay or lie in a quiet place. Number 2, for especially migraine sufferers, it is very important that they take rest or sleep in a quiet and darkened room, because sleep often relieves a migraine headache. Number 3, do not use bright screens or bright lights. Also, try and avoid known triggers if you know what triggers your headache attacks. Number 4, if simple measures do not help in controlling the headache, or if it is quite severe and disabling, you can use over-the-counter medications like paracetamol or ibuprofen, or your doctor prescribed medications. However, do remember not to use these medications more than twice a week. And if you do need them more than twice a week, that means you need medical attention. And last but not the least, number 5, keep well hydrated. So now let's talk about when to seek medical help or attention. Number 1, if you are a sufferer of frequent headache, it's always a good idea to get your eyes checked properly by an ophthalmologist, because simple things like long-sightedness or short-sightedness can cause frequent headaches if left untreated. Number 2, if your child complains of a severe headache for the very first time in their life, or if their headache is unusual severity, which is out of character for them, then you should seek immediate medical attention. Number 3, if your child suffers from frequent headaches more than 2 to 3 times per week, again, it might mean that they need long-term treatment, what we call as prophylaxis, plus minus other investigations. And hence, it's time to visit your doctor. Number 4, if your child has headache along with other problems or symptoms and does not appear well, for example, headache that does not go away within 24 hours, or if the headache is accompanied by reduced consciousness or reduced alertness, fever, neck pain, or a rash, then you should seek immediate medical help. And number 5 is a list of symptoms called the red flag symptoms, which means these symptoms warrant a possible serious underlying disorder and needs medical attention. So these are headaches that occur mainly at night and wake up somebody from sleep, headaches at the back of the head or in the neck, headaches that worsen with activities like coughing, bending, or passing stools. These again warrant immediate medical attention. Okay, now let us discuss 5 points which you can follow to reduce or even prevent your headaches from happening if you are a sufferer from recurrent headaches like migraines. Number 1, hydration. So these days, many children avoid drinking water and they drink too many fizzy drinks or may not drink enough water for fear of going to the loo at school. But this is something that needs to be addressed. So all children should drink a minimum of 1.5 to 2 liters of water beyond the age of 5 to 6 years per day, which should be spread throughout the day. Number 2, sleep hygiene is extremely important. And again, we see these days many times the cause of headaches are because the children go to bed late and then they have an early rise due to the school. So a minimum of 8 to 9 hours of undisturbed sleep at night is essential to prevent recurrent headaches. Number 3 is keeping an active lifestyle and doing some exercise for 20 to 30 minutes per day. Number 4 is avoiding known triggers. So if you know specific things that trigger your headaches, then you can start avoiding them. And one of the simplest ways to know this is to maintain a record of your headaches for over 3 months, what we call as a headache diary. And each time you get a headache, noting down if you did something different in your routine or ate something unusual in the preceding 24 hours. And last but not the least, number 5 is maintaining a proper posture and avoiding too much screen time. Easier said than done these days, but simple measures like having your screen at the level of your eyes and maintaining an erect posture while working on the screen, as well as maintaining a proper distance between your eyes and the screen is essential. Lastly, I will end this talk with one bonus question that gets asked all the time. Does my child need a scan for the headaches? Well, it should be clear from the foregoing discussion that most headaches in children are the primary types of headaches that we discussed, and these do not usually require any brain scans. However, for certain rare types of headaches or when your child has red flag symptoms, then the doctor will do a thorough assessment, including a physical examination, and if required, will order for a brain scan. So friends, remember, headaches in children and adolescents are quite common. Most of the times they do not signify any serious underlying disease or conditions, and they can be easily prevented or managed using simple lifestyle measures as I have discussed. So if you like this video, please hit the like and subscribe button, and also in the comments below, suggest what topics you would like to discuss in a 5-minute neurology consult. So take care and see you with my next video. Stay well and stay safe. Thank you.